Hi everyone. Many of us students, beginners, they have a very big problem facing. Ma'am, how do we select a rubric? Ma'am, how do we decide which rubric is important? So today I'm Dr. Shelly Sharma trying to solve your queries and I'll today try to give a brief summary about rubrics and how to select them. So to broadly differentiate rubrics, we can say that there are two types of rubrics in our repertory. One is objective rubric and one is subjective rubric. So what is the difference between objective rubric and subjective rubric? To understand, let us go deep for it. Objective rubrics are those rubrics which we observe in our patients. Objective rubrics are something which are a part of uncompensated mind of a patient. The patient just throws at you, and these are the most important milestone rubrics in the selection of rubric and the minimum, because the objective rubric are something which a patient speaks the mind without talking about it. Like for example, a patient is just sitting and moving his legs, he's moving his feet constantly. So he is not telling he is restless. Maybe he is not aware of he is restless, but his constant motion of lower extremity shows he is restless or he is nervous. You know, Dr. Hahnemann speaks about the objective rubrics in his footnote 85. In this, he gives so many examples about observations. He speaks about the importance of observation in case taking. Dr. Hahnemann says that observation is the most vital part of case taking, because through observation we can reach to a minimum. And this part of rubric, which is the objective rubric, is useful specifically when you're treating pediatric cases, when you're treating syphilitic cases, when you're treating bedridden cases, when you're treating comatose cases. This kind of rubric are very important because this is only what a patient will throw at you. This is also one of the most important kind of rubrics in acutes. I can give you some examples about objective rubric. So there was a child who was vomiting. So his mother said, my child is vomiting since yesterday and I'm not able to help him. So I tried to ask some questions and I couldn't get the answer. So this child just asked for water and the mother gave him water. The moment he drank the water, he vomited out the water. Again, that was surprising for me. It was such a sudden reaction after water. Then I asked him, is this the same pattern which your child is following after drinking water? She says, yes, the moment he drinks water, he vomits it. This was one observation. Second was the child who was sitting was just cuddling his father. He was not ready to leave his father. And normally this child is very restless. Like to the moment he comes into my clinic, he wants to touch everything. He wants to jump over everything. But today he was just sitting composed, cuddling his father. The moment he is drinking water, he is throwing it out. Remedy was simple, it was phosphorus, and I was amazed to see the result. Like after 15 minutes, the episodes of vomiting stopped. One more example I would like to share with you was, it was a case of high-grade fever and the patient was just drowsy in my waiting room. It took 15 minutes for him to come inside because I was with a new case, but I could see that patient was very drowsy. But the moment a receptionist was asking him anything, he was alert enough to help the receptionist. If a new patient came and he would just ask the patient to please shift, he was alert enough to shift. But the moment he shifted, he again went to the state of drowsiness. He came inside the cabin with his mother. I asked him some questions. He just tried to open his eyes. He replied all the answers and again got back into drowsiness. The remedy was simple. It was opium. So, objective rubrics are very important. The moment patient enters your cabin, you have to search for objective rubrics. When you take the case taking of the patient, you have to hunt for the objective rubrics. You have to be very vigilant. You cannot skip this kind of rubric. Other kind of rubric which is there in your repertory is subjective rubric. So these are those rubrics which the patient gives to you. The patient gives through his past history, his life history, his thoughts, his understanding about his life, his reactions of his life, his desires, aversions, stools, urine, sleep, dreams. These all come into subjective rubrics. This is again a very important part of case taking and rubric selection. So this is in short about what kind of rubrics we have in our repertoire. Now, how to derive to a rubric? How do we get into a rubric? How do we select, okay, this is a rubric I need to select for my minimum or for my totality? For the first step for it is you have to take an in-depth case taking. My guru always says that till you reach the subconscious mind of the patient, do not stop your case taking. So your effort in case taking has to be like an investigating agent. Who is an investigate agent? He goes to the root cause. He goes to the depth of the case taking. You have to go to the depth of the case taking. You have to understand the uncompensated mind of the patient, his nature, why his reactions are like this, why he's so aggressive, why he has so hatred. Like for example, nitric acid, he has a lot of hatred for people. He can be very nihilistic person, but you have to understand why, what is his need, what he didn't got that made him today like this. So when we go to that part of his case, when we go to the subconscious part of his case, we can say our case taking is complete. Now the second step after in-depth case taking is in-depth analysis of the case. So every symptom we get in a case has to be broken down, has to be analyzed. Now there comes the work of a lawyer. The work of a lawyer is to question every symptom, to question every rubric you have selected, question every symptom the patient has given. If the patient says, I weep, just don't take that as a rubric, because weeping is just an action. How the patient weeps, why the patient weeps will help to get to the remedy and not just the rubric weeping. For example, the patient seems to be very loquacious. Just loquacity is not enough to go for the rubric selection. You have to understand how the patient talks, what is the content of his loquacity. If the talk is very incoherent, you can think of ophidias, but the patient is loquacious and the content is about health and family, you can think about remedies like Merksol, you can think of remedies like Kali, you can think of remedies like Nakswamika. So, do not stop your case taking till the rubrics or very superficial rubrics, because that will just lead to a very partial similar remedy. You have to reach to the depth of the case taking. You have to reach to the depth of every rubric selected. It's a very big topic again. Let us go ahead. Once you select the symptoms, now you have to understand and interpret every symptom you have selected, whether this symptom is characteristic, whether this symptom is common. What approach do I have to give to a particular case? We cannot say that I follow only BBCR, I follow only Kentin, I follow only Materia Medica. No, your case will decide what approach you have to follow. In some cases, you need to follow BBCR. In some cases, you need to follow Kentian method. In some cases, you need to follow keynote method. In some cases, you need to follow pathological approach. You have to change your approach case to case. Don't be stuck up in homeopathy, because homeopathy is not one-to-one science. Homeopathy, it's itself an individualized science. So we have to have individual approach to every case. So once you have decided what you have to approach, search for a general rubric in your case. This is again a most important part of case taking. If you get a very general rubric which is true to all part, this is a very strong rubric. Like for example, patient says he is better by motion. He's better by motion in all his joint, he's better by motion at his mind, he's better by motion at his organ level. That amelioration by motion is a very important symptom for us. Or if the patient says he is like better by traveling, if all his complaints are better by traveling, or there's a particular pathology which is common in all the aspect of his condition, you have to think of that rubric or that symptom. And most important comes if you get any strong specific time modality. If you get a very strong modality, aggravation, ameliorating factors, periodical rubric, do consider it, because it's one of the most important part of your totality. So when you are investigating a case, you have to be investigating officer, go to the depth, then you have to be like a lawyer where you have to dissect every symptom you have decided to take into the repertorization sheet, and then you have to be a judge. Like once your totality is formed, you have to decide which remedy you want to give. So let us take some examples of objective rubrics. So one example in the mind is awkwardness. Many times we must have observed that when the patient enters your clinic, he just falls. Or if he has a handkerchief, it will fall 10 times from his hand. If he has a pen, it will fall so many times. Or if he is coming, he will just dash himself here and there. This is a rubric. Don't get irritated on your patient. You can take a rubric awkward. So you do not have to get irritated on your patient's on his behavior. This behavior itself is a reflection of observative rubrics. You have to just search for them. Now, next one which I observe is evading look of person. So there are so many children or adults, when you talk to them, they will just take their eyes down. They will not have a contact with you. And then when you talk to someone else, he will again look at you. The moment you talk to them, they will again look down. So this is one of the most important rubric. Then another important observative rubric or objective rubric comes in the section of answering. Some patients talk or answer in a very uncivil manner. You can see the rubric. You have remedies like lysin, you have remedies like chamomilla. Some people answer very dominatingly. You have remedy platina into it. So the way patient answers is again a part of objective rubric. Some patients answer incoherently. Some patients, when they answer, they are very hurried. So you have to search for this. Some patients are very restless in your clinic. You see some patient timid, blushing, holding their disposition. You can see frowning in many of the patients. Like when you're talking to them, they're just like this. Like angry people, frowning. You have to observe this rubric, frown. Some patients do some gestures like involuntary gestures. They'll just lift their hand beach mein, they'll just involuntarily they will move their hand. You have to take that rubric gesture makes. Some people will just pick their clothes when they're sitting and talking to you. So these are again most important observatory rubrics in your case taking, which you cannot ignore. Again, you have expressions, facial expressions. You can think of remedies which comes into it. Eyes, tired expression, in many of the cases, but just looking at the eye, you can understand and give a remedy. Like I've given lycopodium for so many people where I've seen their eyes were very tired. Obviously, the other thing should match, but that confirmed the remedy. So tired expression of the eye, which is in the eye section. You have half open lids, or you have open lids, right? Only the right eyelid is open, the left is not. It is to be observed in bedridden, comatose patient, in children. Then you have the position of knee. Many patients, when they come to your clinic, you can see their knee are bent inward or outward. That is again a very important observatory symptom. Knocked together, knees are knobby, fingers and toe tips. When the tips are knobby, they are thick, knob-like. This is again a very important observatory symptom. Wrinkled fingers. Some patients have their hands and feet are very wrinkled. They are shriveled. Not everyone will have that. This is again a very good subjective rubric. Let us see some objective rubric. So what kind of rubrics comes in subjective rubric? You have rubrics like ailments from, like from this time my complaint started. Or the patient is dictatorial, there's a lot of hatred, horrible things affect predominantly. When the patient says, I listen to any bad news, someone's death, who is not even related to me, I fall sick. So you have to think about this remedy, horrible things predominantly. Then magnetized desire, for these people like lot of attention. Art ability, this patient can say, I like drawing, I like painting, I can do a lot of artistic thing. Vertigo, desires, aversions come into this. Aggravation, amelioration, sleep, dreams, pain, modality. There's another kind of rubric which is very unique is in general section you have general reaction to medicines, that is allopathic. You have rubric which is related to medicine history specifically, like some people are addicted to medicine, so you have a rubric generals medicine allopathic addiction to, generals medicine allopathic abuse of morphine, generals medicine allopathic oversensitive to. So whenever a patient comes with a reaction after an allopathic medicine, sudden reaction, sometimes a patient will tell you like, doctor, I had this particular medicine XYZ, and after that I started developing loss of memory. I was fine before that, but after this I developed loss of memory. Or if a person says, doctor, I was okay till I took this painkiller, but after that I do not know, I developed asthma or I developed joint pains. So generals medicine oversensitive to, generals medicine allopathic reaction to sudden, these are very important rubrics. Skin eruptions after use of corticosteroids. This is again a very interesting rubric you find in your repertory. Skin eruptions from cosmetics. So in many patients, girls, they come and like, doctor, I was okay, but since I used this cream, I went to the spa, I started getting skin eruptions. Bovista is one of the beautiful remedy for this. After poisoning, patient starts getting complaint. So these are some of the beautiful set of rubrics which are there in your repertory. You just have to develop an art to understand that. It's a very big journey. Still I'm learning. I want you all to understand this pattern of learning of your rubrics. It's very interesting, trust me. In the begin, it seems to be like a hologram. You get confused, you do not know what to do, but trust me, just step into it. It is one of the most beautiful journey you'll have. Till today, I'm enjoying the learning of rubric. So this is all today. I'm Dr. Shelly, and take care of yourself. Bye bye.